Good day. Olabisi Adewale is my name. I'm a lecturer at the Federal College of Education Special Oyo. Today I'll be discussing the difficulties that are faced by persons with special needs in accessing healthcare system in Nigeria. And according to the World Health Organization and the World Bank reports, 2016, it was estimated that 15% of the world population, they have people with disabilities. This is quite alarming. And it is also estimated that in Nigeria, we have about 22 million citizens that are people with disabilities. Invariably, it means that if we have a population of about 160, 170, let's now say at the most 180 million. And out of the population, we have 22 million of the citizenry that are living with disabilities. Then there's need for us to consciously look into how they can live their life meaningfully. And this is just telling us that we need to work and be more proactive in working with them. The disability law in Nigeria gives rights and privilege to persons with disability, which includes education. That means they have rights to be educated. They have right to health care. They have right to be accommodated, to be given accommodation, not that they should be left on the streets. They have a right for other emergencies that we can ever think of. Then again, with the emergence of this law, persons with disabilities are protected. Before the enactment of this law, you discover that they were seen as, they were treated horribly. They were treated just like animals. But with the enactment of this law, things are changing because there is this a kind of reorientation. And with this, we know that they have right to adequate medical services, which when they are given, definitely will improve their lives. Healthcare in Nigeria has been a big problem, I must confess. For people that are not with disability, they struggle to get the best of healthcare. People without disability, some even will they will have to spend a whole day before they could be treated. So if the people that are not with disability are treated this way, what do you think will become of people with disabilities? When we're talking of these people with disabilities, who are these people we're talking about? Those in these categories are people with hearing impairment. I mean, those who could not hear very well. Then again, we have other categories, those that are visually impaired. This set of people are those that could not see, or those that are seeing faintly. We have people that are learning disabled, those who are having problem in one academic work or the other. We have those, again, the intellectually disabled, those that are having intellectual disability. These are people that have sub-average intellectual functioning. Disability manifests itself in maturation, it manifests itself in learning and social adjustment. That's not where we're going. Now, they have another category, people with communication and speech disorder. These are people that could not talk. The speech organs are there, but they are not working perfectly well. They are not working as expected. Then again, we have people that have behavioral disorder. They fall into categories of people with special needs, with disability. Then we have people with multiply handicapping condition. What do I mean by this? These are people that have more than one handicapping condition. And you discover that disability comes with, when somebody is disabled, it comes with other conditions that will inhibit so many things that will not allow the person to achieve as expected. Then again, what are these difficulties in assessing healthcare program for persons with disabilities? Number one, difficulty is the problem of social attitude to those with disability. People with disabilities face a lot of social neglect. The society is not ready for them. They see them in another form. When a child with disability is taken to the hospital, in fact, the doctor that attends to that child, other people might not want to go in there. They think, wow, once a child has been brought into that place, it is going to affect others. So we have a problem, the societal and the attitudinal problem. Number two, we have there is this lack of healthcare policy for those that are living with disability. What do I mean by this? No health insurance policy in Nigeria. There is nothing that will distinguish, that will give them a kind of protection. There is no health policy. There should be free health insurance program for them. There should be a kind of policy that will allow them, when they come in, they are well attended to. We also have limited health care centers. Wow. If you look at the health care centers that we have, they are not sufficient. Not sufficient for those that are without disability. Talk less of those that are having disabilities. We have grossly insufficient healthcare center. Another problem, difficulty that these people with disability face in accessing good health care is shortage of manpower. There should be interpreters in all of our healthcare centers. In fact, the doctors are not enough. A doctor will have to cover about 3-4 health centers, which is grossly inadequate. Then we have problem of accessing these healthcare centers. Road network, even when we are within the premises of the healthcare centers, are there ramp for them to be able to access the consultation room? Will they be able to access the ward without any problem? Will they be able to get to the pharmacy to get the prescribed drugs unhindered? We will discover that we have a lot of accessibility problem, lack of health education for people with disability. Health education for them, so that they will know that if I am having this problem, this is what I should do. First aid education. Then another problem is proximity of these healthcare centers to these people living with disability. In a situation where you have to travel about 20 kilometers before you get to the nearest healthcare center, it is not the best. It is problematic. Then we have infrastructural barriers. The way our healthcare centers are built, they are not well built so that people can access them. No. The environment is not conducive, where you don't have a particular designated place, rooms where people with disability could be attended to. Then we don't have, there's nothing like advocacy and pressure group to harm and just, keep reminding the government that you have not done this enough. This is not enough. No, the advocacy they should be given the best of the best regularly. And that still boils down to what I said the other time, advocacy. That there must be advocacy. There must be health, there must be welfare policy for persons with special needs. Lack of adequate funding of this healthcare center is another problem. Equipment needed are not provided. They are not there. Drugs are not there. So people see it as, why do I have to go? Why do I have to waste precious time going when I know that I'm not going to get anything in return? And this leads to another problem of finding alternative medical solution to health problems, so that there will be all these alternative solutions. No, it's not the best. Then we have inappropriate siting of healthcare centers for persons with disabilities. For the healthcare centers that are on ground, there is lack of awareness for persons with disability on where they can get these, they can get treated. There is nothing they can just get. There is no awareness whatsoever. So when there is no awareness, it's as good as they are not there. So what are the possible solutions? Government should pay more attention to the health needs of persons with disabilities. Our healthcare centers should be well funded. Adequate equipment should be provided for these health centers, so that people with special needs, people with disability can access good health care from these places. We should be able to provide state-of-the-art equipment so that these people will be well taken care of. Drugs should be provided regularly. Records of people with disabilities needs to be taken. That leads to another thing, and that's census of people with disability. Government needs to have a census of people with disability. When we don't have adequate records of people with disability, then we might be able to provide nothing for them. Services rendered will be grossly inadequate. Then again, siting of these healthcare centers should be according to the need. That leads to the point just mentioned, that if we have the census, we know the category. So that is it. We need adequate staffing of our healthcare centers with qualified professionals. The staffs should be well knowledgeable. And my advocacy is this, that people that will be working with people with, professionals that will be working with people with special needs, they should undergo training in special education. At least they should be able to communicate, basic communication in sign language. They should be able to do some braille reading, so that when these people come, they will not go dejected without being treated. Budget of the country. Let us consider the COVID-19 pandemic that we experienced. Nobody ever said anything about people with disability, taking care of them at this time. Nobody. But when you now ask, they will tell you, we are looking into it. What are we looking into? What are we looking into? Parents and caregivers of persons with special needs, they need to form pressure group, so that they are going to pressurize the government on getting things done for these people. Government should embark on awareness program on the need for persons, on the need for those with health issues to take their wards to health centers and not somewhere else. More health centers should be established. And finally, religious bodies and non-governmental organizations should be collaborated with by the government in bringing qualitative health services to persons with special needs. The servants of charity, what they do is they have clinic, they have centers where persons with special needs, when they come, they treat them free of charge. In fact, they have a program where experts will come and do random testing for people with special needs, and take when they see their condition, the servant of charity will take it up, make sure that they are given adequate healthcare service. And they have their centers in Ibadan, Moniya in Oyo State. They have in Owerri and Nebuko in Imo State. And these centers are doing well. People are going there for medical attention. Through the services that is being rendered by the servant of charity, we discover that there are centers and they are just doing fine. If we have more non-governmental organizations collaborating like this, I know the lot of persons with special needs will be well off. Thank you.